Dr. Paulina J. Garcia Memorial Research and Medical Center adheres to 10 policies for the hiring process. Number 1. Announcement of vacancies. As per Republic Act 7041, which is a publication law, all vacant positions should be published before filling up. For promotion, all qualified next in rank should be automatically considered candidates for promotion to the next higher position. And an employee who is on scholarship or fellowship grant, both academic and non-academic secondment, pregnant, or on maternity leave may still be considered for promotion. Number 2. Acceptance of application. Once published and posted, the application with complete requirements as per Civil Service and Department of Health qualification standards shall be addressed and submitted to the Medical Center Chief to be forwarded to Human Resource Management Office for document review. Number 3. Conduction of document review. All requirements will be based on the qualification requirement of the Civil Service Commission and of the Department of Health if applicable. Those are educational attainment, eligibility, training, and experience. Number 4. Administration of general and technical exams. For the administration of examination for entry-level positions, the written examination shall constitute 30% of the applicant's entire rating and will comprise of the general examination, which is 70 points, and the technical examination, which is 30 points. For promotion and transfer, the written examination will also contribute to 30% of their overall rating, wherein the general examination is 30 points and the technical examination is 70 points. Number 5. Character investigation. Once the applicant passes the qualification examination, a character investigation will be conducted. The Human Resource Management Office shall conduct character investigation, and this is equivalent to 15% for entry level and 10% for promotion from the total of 100% of the rating. Number 6. The panel interview. This phase will be conducted by the Human Resource Merit, Promotion, and Selection Board, which is the board responsible for the screening and evaluation of applicants. For the first level and second level positions, the board is comprised of the following: the highest official in charge in Human Resource Management Office or his or her authorized representative, the head of the organizational unit where the vacancy exists or his or her designated alternate, the Human Resource Management Officer, 2 regular and alternate representatives of the rank and file employees for the first level and for the second level, and lastly, the secretary of the board. Number 7. The deliberation. For this phase, the HRMPSB will meet in bank for the deliberation and the rating will be reflected in the comparative assessment report, and it has to be put in resolution. The criteria for selection with the corresponding percentage for each criterion is as follows. For entry-level positions, we have the document review with a total of 25% covering the education, the experience, and the training. The written examination with a total of 30% covering the general and technical exams, and the targeted selection interview with a total of 30%. And lastly, the character investigation for 15% for a total of 100%. Number 8. The comparative assessment report. The said forms for both entry-level positions and those for promotion and transfer, together with other pertinent documents, are then submitted to the appointing authority for the final selection. Remember, it is the discretion of the medical center chief or the appointing authority to choose among the top 5 applicants only. The comparative assessment report of the HRMPSB or for the first and second level shall be valid for the period of 1 year reckoned from the date of deliberation. The Medical Center Chief and Chief of Medical Professional Staff positions shall be evaluated by the Department of Health and shall be appointed by the Secretary of Health. The appointment of the CMPS shall be approved by the appropriate Undersecretary as delegated by the Secretary of Health. Number 9. Preparation of documents for appointment. The following documents constitute the list of required papers to be submitted to the Human Resource Management Office. Duly accomplished personal data sheet with attached work experience sheet. The valid PRC ID with board certificate or authenticated CSC certification of eligibility. The certified true copy of transcript of records or the diploma. Medical certificate with documentary stamp plus the original results of the diagnostic examinations, the original copy of the psychological test and drug test results, statement of assets, liabilities, and net worth, the certificate of being fellow or diplomate of specialty society if applicable, the original copy of NBI clearance, duly authenticated birth certificate, duly authenticated marriage certificate if applicable, clearance from previous office for reemployment or transfer, photocopy of community tax certificate or cedula, and lastly, dental records. And last but not least, number 10, onboarding. This refers to the process of acculturation of newly hired personnel, and it includes the orientation of the employees on the duties and responsibilities with the different hospital policies and others.